Hello there, my name is Justin Yeung. I'm a consultant colorectal surgeon at Western Health, as well as the head of Department of Surgery, Western Precinct, University of Melbourne. ProInclude is the patient-reported outcomes in colorectal cancer patients from culturally and linguistically diverse backgrounds, a joint project between Western Health and the Peter MacCallum Centre. The aims of our project were twofold. Firstly, to evaluate patient-reported outcome measures, or PROMs, processes for patients undergoing colorectal cancer treatments who are from English and culturally and linguistically diverse backgrounds. Secondly, to report on quality of life questionnaire results of these participants. So you might ask, why this project? Well, as a clinician, we are always focused on curing cancer, but the effects of cancer and its treatment on patient quality of life isn't routinely measured or acted on. PROMs are an essential component of informed healthcare delivery, and it can be hard to deliver in practice for reasons including a lack of translated tools for the CALD population, which in our cohort can be up to a third, the lack of research into cultural appropriateness, feasibility, and acceptability, and therefore it leads to patients being excluded from PROMs research or its routine use in clinical practices, in particular the CALD patients, as it's too hard to do so. This study therefore aimed to address this knowledge gap. So for our project, we selected the EQ5D5L as well as the EORTC generic and colorectal cancer specific questionnaires in English and the top 5 most common CALD languages. We wanted to also embed consumer input in our project. All of the CALD languages had a translated and validated questionnaire except for the Vietnamese language. Therefore, the first step was to develop the QLQC29 in Vietnamese. We translated and validated using the guidelines from the EORTC. It was a comprehensive procedure which included many back and forward translations. It then had linguistic validation with Vietnamese speaking patients. And finally, this led to an approval by EORTC, which is now available on their website for international use. We're then ready to commence our project across 2 sites, Western Health and the Peter MacCallum Cancer Centre. Patients were identified during their multidisciplinary meetings when they had their colorectal cancer management discussed, and were recruited after their initial surgical consultation. We administered the PROMs at the following time points: at baseline or just prior to surgery, their first post-op review after discharge from surgery, usually 2 to 4 weeks, then 3 months, and finally at 6 months post-operatively. We then invited patients to have an interview with the following themes, which is centered on the acceptability, appropriateness, and feasibility of measuring PROMs in our patient cohort. We also asked patients on their views, including question content and frequency of surveys, their thoughts on ease of completion, how they felt the format of the questionnaire should be done, whether paper or electronic, methodology of questionnaire administration, as well as support required in able to do this for all patients. We started recruitment in October 2019, but unfortunately due to COVID, we paused in March 2020. We were able to recommence in July 2020 following a COVID-safe change in protocol, which removed face-to-face exposure. We're planning to complete the data collection in December of this year, and we'll be able to then evaluate and offer final results shortly after. Look at recruitment. Initially, we identified 128 patients from our MDM who fulfilled our inclusion criteria as demonstrated in this green circle. Up to now, 39 patients were recruited, 36 English speaking and 4 CALD. There were many reasons for non-recruitment. Some were patient-centered, for example, they weren't interested or just too overwhelmed. Some were due to other factors, such as patients being treated elsewhere, both privately or in another center. And there was also other reasons as well. We then had a further 5 English-speaking patients who withdrew, leaving a total of 35 patients. This diagram illustrates where we are with all our patients with respect to their PROMS completion. As we progressed to the 6-month period, we have noticed that there were a handful of patients who have stopped completing the questionnaires. The reasons for non-completion included that some of the patients felt too unwell to complete the PROMS after surgery, or they're simply unable to be contacted. This pie chart illustrates the diversity of patients which we recruited in the project. Many patients were born in non-English speaking countries and yet completed their PROMS in English. And in fact, only 4 patients completed a translated PROMS. I wanted to use this diagram to highlight some issues to consider when we talk about CALD patients. The level of language competency is a sliding scale rather than a black and white yes or no. Oral competency doesn't mean written competency. When an interpreter is needed, how is this defined? What does this actually mean? And who determines what level of competency is sufficient? Is it the patient? Is it the family? Is it the clinician? I guess we probably need to consider that patient self-identification is the best measure that we have currently. We also wanted to explain why CALD recruitment has been lower than expected compared to previous years. Our 2020 patient cohort had lower percentage of patients born overseas and needing an interpreter compared to the previous 3 years. We don't really know how COVID's impacted on our patients presenting. And certainly some languages do not have translated PROMS tools available, and patients have presented from other backgrounds as well. Our project then morphed into stage 2 when we realized that CALD enrollment was lower than anticipated. So following an ethics amendment, we contacted past CALD patients who had previous colorectal cancer surgery. We then asked them to complete a translated questionnaire, then interview them with an interpreter to gather their feedback on their thoughts of PROMS and their appropriateness, feasibility, and acceptability in clinical practice. To summarize our findings to date, the definition of CALD is complex, as we know, with no agreed simple meaning. Interpreter needs in hospital data systems is not often correct, and literacy is rarely recorded. CALD patients are not declining more than English-speaking patients, interestingly enough. Early results show that support for PROMS are both present by CALD and English-speaking patients. The timing of the first PROMS questionnaire seems important in relation to the reduction of anxiety and willingness for the patient to take part. And patient self-identification of CALD remains best indicator. So what are the next steps? The interviews need to be completed for both English and CALD patients. We need to evaluate the implementation process in different hospital settings in order to promote PROMS use in the future. And finally, we hope to report our PROMS results shortly. Moving forwards, using our experience from ProInclude, we've been working with Western Health and a startup company over the last year to develop a new electronic PROMS platform, which we will be trialing in colorectal cancer patients. A great secondary project, which we'll like to carry out, would be to evaluate the use of electronic PROMS in both English and CALD colorectal cancer patients, and how we can apply its use in other cancer streams. So what's been the impact of our project? Well, for sure, we've done a translation of EORTC PROMS questionnaire into Vietnamese, which can now be used internationally. Our projects helped with the development and trialing of a electronic PROMS platform in colorectal cancer patients at Western Health. And we would have gained a greater understanding of PROMS use with CALD patients. If you'd like any further information or would like to discuss future projects, please do not hesitate to contact me or Sally, our project officer. Thank you so much for your time, and I look forward to your questions.